It started slowly, but people were coming in very sick with opportunistic infections that we didn't expect, young people who had been healthy, and we didn't know what was going on. I remember getting dressed up in these yellow gowns and masks and shower caps and booties and gloves and walking into these people's rooms like space people, being afraid to touch them, just really not knowing what was going on and not knowing what the contagion possibilities were.
Here and there over the next months and year, there were occasional cases of similar kinds of unusual either infections or very aggressive cancers, or people just dying of sepsis for no apparent reason. And then it started to eventually, within a year or so, coalesce into sort of the realization that this phenomenon was happening here as well in the Bronx.
But there was a tremendous amount of hysteria and fear, lots of stories of people being put in isolation rooms who really didn't need to be isolated and having their food left on the floor outside the room, and people not getting cleaned. And I mean, it's just really, at the beginning, a tremendous amount of terror.
When prisoners with HIV infection had to go to court, staff wore spacesuits. They wore masks, they wore hazmat kinds of uniform. Judges were afraid to let people into their courtrooms and sometimes refused to allow people into the courtroom. So it was quite an hysterical moment.
The specialists wouldn't take care of our patients. You couldn't get them to do surgical procedures because of their fear that they would get infected. But I always thought it was a code for not taking care of injecting drug users or poor people, But they wouldn't come into the room of our patients. Nurses would not come into the room of our patients, So that was one thing that was happening. Funeral homes, which would not take our patients.
Those of us in primary care would keep a mental list of consultants that we could use and who would not only accept the patients but treat them like human beings, right, and not, give them the feeling like they were lepers walking into the exam room.
Coming to New York, I didn't know very well the different places, and in fact, I was not expecting to see so many HIV positive in the Bronx. I didn't know, that it was a big pocket of HIV patients.
There were policies to cut fire stations in the Bronx in the early 1980s, at a time when landlords were burning down their houses to collect insurance money. So that, there's the phrase, the Bronx is burning. The Bronx literally was burning at a time when the city was, because of the financial crisis it was in, cutting back on fire stations. So there was this tremendous neglect of things that were going, a tremendous neglect of the Bronx as part of New York City.
The Bronx was and remains one of the poorest counties in the United States. And all of the social issues that were prevalent in the 1970s and 1980s were there. I mean, there was homelessness, there was rampant drug addiction, there was destruction of whole neighborhoods.
The building where our clinic was housed had this huge pile of rubble next to it, and as I approached the clinic, I saw these two persons wearing blankets come out of the rubble, and I realized that these were two individuals who were living in the rubble. And I don't know, it was emblematic kind of the period.
Horrendous living conditions. They were burnt out buildings. There were many people without homes, without heat, without food. It was a really tough time. There was a lot of crime. People who were afraid to go out.
I mean, it devastated the Bronx. I mean, but it was an extension of what else was devastating the Bronx, and it was symbolic of what else was devastating the Bronx. So the amount of homelessness and the amount of substance use that was going on in the Bronx.
When I first arrived on Fulton Avenue in 1988, there were crack vials all over the street and vacant lots that were people used to shoot up, and we crack houses, and just, it was just a setup for transmission of HIV and a lot of other stuff as well.
The whole first decade of the AIDS epidemic was during the Ronald Reagan years, and he and his administration were very late in responding in any meaningful, let alone positive way to the epidemic. Some of the state and local responses were better and quicker, but I think it felt for a while that this was really something in the shadows that nobody wanted to take seriously or, respond to.
It was a very fraught time. Not only didn't we have treatments, let alone a cure for HIV, people were dying. The sort of notion of AIDS as a death sentence was very common, and our role as healthcare providers was to be a witness.
People really would resist being diagnosed. They would come in with an AIDS-defining condition. And you could tell them, I'm pretty sure this is HIV related. Would you like to test? And a lot of times they would say, oh no, this is something else.
There was also the stigma attached to the HIV where people didn't even want to be tested. So people did prefer to basically die instead of being tested.
At that time, I think roughly a third of the patients in the hospital were HIV infected. They weren't all here because of their HIV, but it was a large part of what we saw on the wards at the time.
By 1984, when we were able to identify HIV status based upon an antibody test, based upon the ELISA test, we found out that 25% of people entering Rikers Island were HIV positive.
In fact, I just was in a meeting with the Bronx Borough president where he said, what's wrong? Why do we have the worst health statistics? And I don't think there's a simple answer for that, but I think it's the additive and cumulative effect of generations of poverty, of sweeping through drug epidemics, lack of job opportunity, and just poverty and racism really holding back whole communities from education, resources, and other things that can save their health.
In the Bronx, even though people were sick and were dying of HIV, HIV wasn't their number one priority in their lives. Their day-to-day survival, finding housing, finding food, being safe, domestic violence, substance use, those tended to be higher priorities than HIV. So it was really hard to convince people to come, get their care, be monitored, and it was this competing interests. As a physician, you were just concerned with what their medical issues were. But these overwhelming psychosocial issues dominated. As you can see, it's still happening today, but they clearly dominated the lives of people, and it was so hard to convince people that they were going to get sick and die, and that we wanted to help them, support them, when so many things were getting in their way.